Good afternoon, everybody. Um, my topic is Asperger's syndrome. What is Asperger's syndrome? Asperger's syndrome is a developmental disorder affecting the ability to effectively socialize and communicate. It is a condition on the autism spectrum with generally higher functioning. Asperger's syndrome exhibits poor social interactions, odd speech patterns, limited facial expressions, and other mannerisms. It also engages in obsessive routines and showing an unusual sensitivity to stimuli. The signs and symptoms of Asperger's syndrome: conversations that almost revolve around themselves or a certain topic. Also, speech that sounds unusual, such as flat, high pitched, quiet, loud, or robotic. Signs and symptoms of Asperger's syndrome. And it is an intense obsession with one or two specific narrow subjects, becoming upset at any small changes in routines. Hypersensitivity to light, sounds, and textures. For example, sounds, any type of fire alarm sound, something like that, affects a person with Asperger's syndrome. Also, signs and symptoms of Asperger's syndrome. Difficulty controlling emotions sometimes leads to verbal and behavioral outbursts, self-injuries, behaviors, or tantrums. Self-injuries, for example, someone that's trying to harm themselves, either bite, hit their head, or pinch, anything like that, trying to hurt themselves. What causes Asperger's syndrome? There is no single known cause for this Asperger's syndrome, including Asperger's. These factors may play an important role: genetics, physical factors, and the environment. But overall, Asperger's syndrome is a neurobiological disorder. Asperger's syndrome diagnosis. Asperger's syndrome is no longer diagnosed on its own. It is under the umbrella of autism spectrum disorder, such as ASD. This condition is called a high functioning of ASD, which means the symptoms are less severe than any other types of ASD. Testing and assessments are usually involved with, uh, with the medical and physical psychological teams. These certified specialists usually they will interact with a child, conduct several tests to evaluate that child, and check for any language and intellectual abilities along with any medical concerns. Asperger's syndrome treatment also has a condition that is treated by a team: psychologist, pediatric neurologist, developmental pediatrician, and a psychiatrist. They usually um, treat uh, people with Asperger's syndrome. Asperger's syndrome treatments. Social skills training is one. It teaches your child how to interact with others and express their feelings. Another training is cognitive behavioral therapy. It helps the child to change their way of thinking, to control their emotions, and repeated behaviors. Speech language therapy. It helps to improve your child's language and their communication skills. Parent education and training teaches the parents to continue the social skills that their child has already learned and reinforcing it at home. Other options families consider is going to a therapist to help them understand the challenges of having someone with Asperger's syndrome. Asperger's syndrome continues with behavior supports, occupational therapy, special education classes, and medication. Life with Asperger's syndrome. Living with someone or having ASD can be difficult on a daily basis, although finding resources and planning for their future can help promote a better quality of life. This is my presentation on for Asperger's syndrome. Thank you so much for listening.